Hi, I'm Angelique Martis Ramu, your host for A Better Place. Welcome to part 2 of our program on prenatal care, where our guest today is Dr. Randall Friday.
Wants the same nail color day after day?
Not me.
New Revlon Top Speed Nail Enamel. Cool color with a built-in top coat that sets in just 60 seconds.
With Revlon, you can change your mind again and again and again.
New Revlon Top Speed Nail Enamel.
Are you ready to jump?
Yeah, I've got the very pretty insurances parachute.
Is that a good quality parachute?
I don't know, but all the things they told me about it sounded very pretty.
Well, okay then. Let's do this.
Hey, 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 hey,
Gotcha! Hey, I've got you, man. Relax. I've got you.
I gotta get myself one of those Henderson Insurances parachutes.
The right coverage when you need it.
Okay, can you just name then one or two general tests that you do with all of the women and give a little explanation as to
Well, I
what
think
they
the
are?
major test we do is at 35 weeks, or 35, 36 weeks. The major issue we have in St. Martin is infection. A lot of women are leaking during pregnancy and they don't say much, and that's when baby gets infected. Or if you have an infection in the birth canal before baby is born, then most babies come out infected. You can talk to Dr. Fringer, who's a pediatrician. That's the number one reason why most babies go to the pediatric ward is because of infection. So at 35 weeks, we check the urine, we check the vagina, we check the rectum for various things called group B strep, and we check for gonorrhea and chlamydia to make sure that these things are non-existent at 35 weeks. And then if it's positive, then we can treat it. So that's what I'm saying. If you go to Europe or the US, infection might not be a huge issue, so you don't have to do those tests. But here, I make it mandatory for all patients that we check for those things. So we can lessen the infection rate of baby. This is babies we're talking about, because a woman can have gonorrhea and she not know it. So we check for it definitely at 35 weeks. And the rate of gonorrhea and chlamydia in St. Martin is tremendously high. So we check for those things and then we can treat it. And then you have to check for it closer to delivery, because if you treat it in a woman, she can really get it back. So we have to do it close enough to delivery where if we treat it, they don't get it back again. So that's one thing we do for sure, testing for infection close to delivery. Mm-hmm. And I think that drops the rate tremendously of sick babies and so forth.
You talked about a lot of women are leaking and they don't know. Leaking
Well,
of...
I mean, the leaking amniotic fluid, because most of them think it's, during pregnancy you have an increased vaginal discharge, you have leaking of urine also, so some women think it's just, hey, I'm leaking.
Okay.
But they don't know it's leaking from the amniotic fluid, and that's another reason why we do ultrasound so often, because most of the leaking happens after 30 weeks. So if a woman doesn't tell me anything, I can see it by ultrasound that the fluid is tremendously low, and you try to figure out why the fluid is low. So that's why I said in the last trimester, after 30 weeks, it's very important that you do ultrasounds more often. So the infection is a huge issue in St. Martin, in the Caribbean itself.
And these infections, they come about because of what?
Well, I mean, first of all, if you're leaking,
right.
If you're leaking, that means the secure environment that the baby is in is no longer there. Mm-hmm. So any infection can go up at that point. So if I do an ultrasound, I don't necessarily see if baby has an infection.
Right.
But I can see that the fluid is low. I can see that baby is not moving as much. But the best patient is a patient who's a great historian. A mother spends more time with her baby than I do. So when I ask a woman how she's doing, if she doesn't tell me certain things, then it makes for a complicated pregnancy. So a woman who pays attention and who tells me what's going on, and she might not think it's important, but it may be important to me. So the best patient is a great historian, and with the internet also, most patients are informed, very well informed, a little too informed, because then they take the slightest things seriously, but it's fine. At least we can have a discussion about that. So the best patient is an informed patient.
Yes, because I know, for example, one of the tests that they do on the friend side that is totally a part of it is they check for to see if the child might have
Down syndrome.
Down syndrome.
Yeah,
And I
the
know
triple
over
screen.
here they don't. I mean,
Well, the issue is, I make it mandatory to do that for all women over 35 years of age.
Right.
It's mandatory for me, but I send them to the French labs to get it done because we have issues with getting it done on the Dutch side. But I make it mandatory for all women under 35, and I give it as an option to women under 35 because the majority of Down syndrome and other chromosomal abnormalities happen to women over 35 years of age. So that's what I'm saying. On the French side, they check everybody.
Yeah.
But I don't think that's necessary, and it's a rather expensive test because when I send a woman to the French lab to get it done, she pays for it. So I can do an ultrasound where I can check certain things to also reassure myself and the woman that the pregnancy is okay without doing all those tests. But over 35 for sure. We haven't had any Down syndrome babies as yet, but it happens. It definitely happens. You only need one.
but do you think it's wise for a doctor to tell a patient, especially one who's over 35, then that you know, I'm not going to recommend you to do that test anyway, because what will you do if you find out? You're already so
Yeah.
far along in pregnancy. You
Yeah.
probably will still opt to keep the child anyway.
Well, I think it's a fair question that the fact that what are you going to do about it? Are you going to terminate? But some women, first of all, if you do the test at 15 weeks, which is a blood test, we call it a triple screen. Now we can do the quad screen, which is another blood test. But after that, if it's in the middle or in the gray zone, then we can do an amniocentesis, which is sticking a needle into the abdomen and pulling out fluid. So the triple screen is a screening test. The amniocentesis is a definitive test. So that for sure tells us if there's any abnormalities. And we can do that at 18 weeks. So if a baby, if there's amniocentesis comes back as Down syndrome, it is a fair question. Are you going to terminate your pregnancy at 18 weeks? But even more importantly, a woman just wants to know. She needs to prepare herself. But the body is a wonderful thing. Most abnormal babies miscarry in the first trimester. So, although miscarriages are a traumatic thing for the woman, in a way, it's the body's way of cleansing or getting rid of an abnormal pregnancy most of the time. So the fact that a woman gets past 12 weeks lends itself sometimes to tell us that the pregnancy is more normal than abnormal. So there's ultrasound, there's blood tests, there's so many things that we can do to reassure myself and the patient that the pregnancy is okay. But absolutely over 35, we do all the necessary tests to check for abnormal babies.
Okay, in the beginning we talked about the use of alcohol and drugs being not a plus for a pregnant lady. Are there any other aspects you might say that they shouldn't do?
Well, I think alcohol use, I hate to say this because it's still the number one cause of mental retardation in babies, alcohol use. But the problem with alcohol use is you may drink 1 glass of wine twice a week, and another woman may drink 10 glasses of wine in a week, and she's fine, but you have a baby with mental retardation. There is no figure that we can say, hey, don't drink more than 5 drinks a week or else your baby will have a problem. It depends on the woman. It depends on how she metabolizes alcohol. So instead of saying drink in moderation, we just simply said don't drink at all, because we don't know. 1 drink a week may be enough to cause a baby with fetal alcohol syndrome. So I've seen it quite often in the U.S. I don't see it as a huge issue, though, because I think our society, it's so strange. You can see a woman pregnant smoking and no one really fusses, but drinking while pregnant is a huge issue. Family members and other issues, we look at a woman as she's insane if she does that. Because alcohol, we just don't know how much drinks is enough to cause a significant problem. So we just said don't drink during pregnancy.
Okay, you say don't drink during pregnancy. You also say don't smoke. But you just mentioned that some women still do.
Yeah, because I think it's a little bit more acceptable. But then again, I think it's just wrong because smoking can lead to tremendously small babies and other issues. But at the end of the day, most women, I must admit, quit smoking during pregnancy. But I still see a lot of women smoking during pregnancy. It's a difficult thing to quit. But alcohol causes significantly more problems during pregnancy than smoking does, but both of them are bad. Smoking doesn't cause mental retardation, alcohol does. So,
it doesn't?
Smoking doesn't cause mental retardation. It causes for small babies. It causes for low fluid during pregnancy. And it just causes for a complicated pregnancy, but it's still not a good thing because if you have a very small baby, then you can have a baby with asthma. Smoking could cause asthma after birth. It can cause, if you have a small baby, you can have a baby that's tremendously sick during after it delivers. So you have a lifelong of issues for both of them. But obviously mental retardation is a huge issue because you can't overcome that. You can overcome maybe a small baby with nutrition and so forth, but you can't overcome mental retardation. If you're mentally retarded, you're mentally retarded.
What about drugs?
Actually, I don't see it as much. Actually, we don't, and that's why I said with a routine prenatal care program, I don't check. We can check the urine for drugs and so forth, for the metabolites of drugs, but we don't do it routinely unless we suspect something. And then we can see, so I don't see it as a huge issue in St. Martin. As I said, most pregnant women are very responsible during pregnancy. We have a lot of women, however, smoke marijuana during pregnancy. And actually, in our books and so forth, if you look on the internet, marijuana itself, and I hate to say this, doesn't cause too many problems during pregnancy, but the smoking itself, any type of smoking, causes the problems that I told you about. So marijuana has an effect on pregnancy, but tobacco, cigarette smoking is much worse in terms of the effects of on baby.
What causes a woman to not have a natural childbirth?
Natural as in vaginal delivery?
Right.
Well, one of the problems that we have here is a tremendously high C-section rate. At the end of the day, our C-section rate is 50%. On average, in the Western Hemisphere, the C-section rate should be 30%. So we're very high. And the other issue is that there's a notion of once a C-section, always a C-section, which is not necessarily true. But one of the things is if you're going to have a woman have a vaginal delivery after a C-section, it makes for a very focused delivery. You have to be there. You have to be very attentive. And you have to be right there at the bedside most of the times, which we can't do. So the safest things at time is to have a repeat C-section, but it's not totally necessary. I think if you choose certain women carefully, those women who are responsible during pregnancy, who don't gain too much weight, we do allow them to have a repeat vaginal delivery after a C-section. So it's not always that if you have a C-section, you gotta always have one. If you have two, definitely you need a third one. But if you have one, you can try to deliver vaginally.
Together again.
Lasagna, a torture test for the best non-stick surface. The Scotch-Brite no-scratch multi-purpose sponge with its unique cellulose weave whisks grime away, leaving expensive cookware scratch-free and spotless. Scotch-Brite, smart, simple and clean.